For employers that are thinking about adding a wellness program, this may be the perfect time to do it. We're on slide 15 because there are going to be grants available through the federal government. You got $200 million that has been earmarked for fiscal years 2011 through 2015. There is a requirement that the employer not have a wellness program in place as of March 23rd. So this is really encouraging employers to establish new wellness programs. Unfortunately, Gina, you know, there's no applications out yet from the Health and Human Services or Department of Labor on what the criteria is going to be, how they're going to apply for it, and the specifics. So we're just going to have to wait and see what those specific provisions are to see how many employers are going to be really able to benefit from this provision.
Okay, so we don't know if this is talking about a membership to a health club. We don't know if this is about nutrition programs, smoking cessation, a Weight Watcher plan, any of those kind of programs yet. We're still waiting to see.
Well, we do know that it's probably going to encompass a lot of those areas, and that health risk assessments, I'm sure, are going to be a major target because that's one way that you can track changes in the employee's health conditions, and that's going to be an integral part of being able to access this grant money. You're going to have to show that you have met some objectives in changing the health of your employees.
Okay, now this is just for small employers.
Yes, this is for
these grants. And a small employer is what? How do we define that for purposes of the wellness grant?
It's under this provision, it is an employer with less than 100 employees who work 25 hours or more per week.
So again, this is just for the smaller employers. We assume the larger employers have some programs that maybe they've already established, or they just probably have more funds, where small employers might not have the money to do some of these kind of things.
Yeah, that's correct, Gina. And there are incentives currently available that allow large employers to provide the financial incentives for their employees, and that's another provision that they're looking at, increasing the percentage or the amount that employers can provide back to the employees to get them involved in these programs. That took effect for groups renewing on or after September 23rd. Okay. I want to move on now to some areas of change that take effect in less than a month. We're on slide 16. We're going to talk about some changes on the health savings accounts and flexible spending accounts. You'll note that there is a higher penalty for taking money out for ineligible expenses. Currently, an employee would pay income tax, regular ordinary income, and be subject to a 10% penalty. As of January 1st, that's going to be doubled. That penalty is going to go from 10% to 20%.
Okay, if they use funds, monies in these funds for things that don't meet the plan provisions.
That's exactly right.
Okay.
The second area deals with reimbursement for over-the-counter drugs, that in order to use your account to pay for over-the-counter medications, now as of January 1st, you'll have to have a prescription. So basically what they're saying is they don't want you to use your money in that account for over-the-counter medications.
So it's going back to the way it used to be. Because when flexible spending accounts first came out, it had to be prescription. Then they changed it. Same with health savings accounts then.
Yeah, you're exactly right. You know, it's funny how things move back.
Full circle.
Full circle. I did want to say that there is one exception to the over-the-counter area, and that is for insulin and diabetic medication. They said that it's okay that you can use your account for those diabetic expenses.
Okay.
And the third area is a simple cafeteria plan. This is a way to encourage small employers to pre-tax the benefits for their employees, which most employers are aware that they can save money on their FICA match and also benefit their employees on their portion of the FICA as well as the pre-tax benefit that the employees get. And it's going to make it easier for employers to set up these plans because it's going to waive the requirements for discrimination testing.
So are these better ways to set up Section 125 plans?
Well, you know, when the government gives, they also put in some restrictions there, and there are some pretty hefty restrictions on the contributions that are required by the employer to these plans. So you really have to look into it and determine if it's going to benefit you as an employer for your group.
Okay.
We're going to talk about the Community Living Assistance Service and Supports, which is called the CLASS Act, on slide 17. This created a public long-term care program, and it prohibits any underwriting, so anybody's going to be able to get benefit. That if you are aware of how long-term care works, there is more underwriting done for this type of product than just about any other insurance product known to man. So basically guaranteed issue for applicants that are 18 years or older, but it's got to be through the employer. Now initially it was thought that all employers in the country are going to have to provide this to their employees. We've gotten clarification now that an employer can waive and not offer this benefit to their employees. However, if an employee says that they want it, I think there's going to be a provision that the employer is going to have to provide it. So stay tuned for that. It's interesting on this, Gina, because it says in the law that it goes into effect January 1st, 2011, yet it doesn't require that Health and Human Services establish what the guidelines are until October of 2012. So, you know, in practical terms, we don't expect this to roll out until probably the beginning of 2013.
So people that work for a company, if they want long-term care insurance, then they can get it.
As of the rollout in 2013, they would be eligible to enroll in the federal CLASS program for this coverage. But I want to tell you that there's some pretty major restraints on this benefit, because under the federal program, you have to pay into this benefit for 5 years before you're eligible for any benefits. Can you believe that?
Wow, 60 months you have to pay in premiums before you can draw benefits.
That's absolutely right. If you pay in for 4 years and you need long-term care benefits, you have no coverage because you have not met that 5-year waiting period.
So it sounds like something good on paper, but maybe actuality, the benefits are yet to be determined.
You're exactly right, and the other big question is how much are those benefits going to cost? It's set up that the government is not taking any risk whatsoever, so they're saying that once they get the initial enrollees, they're going to look at the risk and determine actuarially what the cost is going to be. Now keep in mind, this is for people regardless of their health conditions, and I think we're going to see people gravitate to this plan that, you know, have not been eligible for long-term care coverage on an individual or group basis. So we're likely to have a lot of really sick people, and the cost could be, you know, really prohibitive.
Right.
I'm going to talk about reporting requirements because we're on slide 18, and the first area is the reporting of the aggregate cost of health benefits on W-2 forms. You may not be aware this was going to be a mandatory requirement, and just recently they came back and said we're going to make it voluntary for 2011, which is a good thing that the employers really cried out and said, hey, we don't have enough time. Payroll companies are going to have to scramble. We need more time. So this is a voluntary requirement for 2011. At this point, it is mandatory for 2012 tax year.